Hi everybody, this is Avion Murphy coming to you to talk about fibromyalgia. Today is 15th February 2019. I hope you're all having a beautiful day and finding some peace and joy where you can. I'm going to try to keep this brief and to the point, but I'm not sure how long I'll talk, so bear with me. I have a compulsion and an inspiration to talk about the concept of disability today. In my previous videos, I talked about how I have been in denial that I have fibromyalgia, an incurable condition, neurological condition. If you're new to the channel or if you're new to fibromyalgia, fibromyalgia is a neurological condition for which there is no cure. We can only treat the symptoms. Unlike many other conditions and diseases, fibromyalgia is marked by chronic pain, and science has shown that it is basically our perception of pain because of our pain receptors in our body. Long story, not going to get into that now, but just wanted to give you a brief introduction. So the last video, I think I talked a little bit about how I was in denial that I had fibromyalgia, and I started these videos early on wanting to be the poster child of someone who could, quote, beat, close quote, fibromyalgia. And to some extent, since my diagnosis in 2015, I have been living a good quality of life, and considering where I was in 2015, where I couldn't climb stairs and had to take that little electric grocery cart when I did grocery shopping, to where I am now, where I'm working and trying to be a productive part of society and have a good quality of life. I would say that I'm living successfully with fibromyalgia. So many of us are not living successfully with it. We're not doing well. I try to monitor fibromyalgia support groups, and on YouTube and on Facebook, and many of us are not doing well, and I feel like it's a rabbit hole that we go down when we start checking in on how other people are doing, because while it is compassionate to think about others, the crux of living with fibromyalgia is that we really have to focus on ourselves and ourselves alone. So there's this fine line between reaching out to others for help in these support groups, these online support groups, and then getting so wrapped up in it that we forget that really it's our journey and nobody can take our journey for us. Okay, but here I go digressing. So I had said in a previous video that I was in denial, and I finally faced it, and I was going to investigate trying to apply for Social Security disability. I live here in the Northeast of the United States, and I authored a book published in 2016 called Viral, A True Story of Epidemic Flu Fear and Faith After a Catastrophe that occurred, which hospitalized both my husband and myself after we were sick for quite a while, and then finally contracted the H1N1 swine flu virus. And then all of the cascade of things that happened following our hospitalization, which led to my diagnosis of fibromyalgia. And because of his consequences of his illness, he was in the ICU in a coma for 33 days. He had major surgery, total organ failure, and cardiac arrest, and then suffered 2 more injuries when he was hospitalized in rehab. He was out of oxygen for in and out, like very low oxygen while he was in the coma, even though he was in the ICU and in the best of care. He had acute respiratory distress syndrome, ARDS, and so the ventilator would breathe for him, and it's just a nightmare. So anyway, he filed for disability, and he tried twice, and the third time my father convinced him that he needed to get a lawyer. And sure enough, the third time was the charm. But the hell that we went through with all the paperwork and the processing and all that was just quite memorable. It's just remarkable what you have to go through, especially because you're sick and you really do need the disability benefits, and you're so sick that you can't even manage the paperwork. It's a mountain that you just can't climb. So that's why you have to get an attorney. So the reason I tell you this story is that I just decided that I'm going to skip all that apply, wait, anguish, worry, invest all this time and effort, and then get a denial, and then go back and do it again. So I was going to just fast track it right to get an attorney. So once I made my mind up that I was going to apply for disability, because I felt that my disability has become so demonstrative in reducing the things that I can do in my life, that I was pretty sure that I would qualify. And I know other people who have fibromyalgia who have qualified for disability, and so I was pretty sure that I was going to be able to, with an attorney's help, I thought I would be able to acquire that. So last week, or no, this past week, I finally spoke to an attorney who said that he had 26 cases under his belt, and he asked me a few questions. He asked what I did for a living. I told him I was a teacher. He asked me if I was working. I said yes, but not full-time. And I'm in and out of employment between full-time and part-time. Most of the time I have to work, so my answer was yes, I'm working. I have to work. I can't not work, but it's hell. And he said, well, I can tell you that after 26 cases that there was going to be, if I went to court, there was going to be a disability credentialing specialist who would sit there and ask me, or an employment credentialing specialist, I guess, who would ask me if I was working or not, and if I could do this job, this job, this job, this job, or this job. And if my answer would be yes, I probably could do that job, then I would be denied for Social Security disability. So a strange turn of events, which in previous months or years ago, a couple of years ago, having this kind of stressor, right? Even just the roller coaster of, do I file for disability? Do I not file for disability? Am I disabled? Am I not disabled? Is it a disability? Is it something I can live with? I am living with it. Can I work? I am working, but it's hell. My life is just upside down now. It's not what it used to be. All of this nonsense going through my head, all these internal, these gremlins, I call them, that plague my mind. So years ago, that probably would have destroyed me, sent me into a flare-up, and sent me to bed. And I heard it. I heard from the attorney. I emailed my friends and my family, and I said, well, that's it. I'm not going to qualify, so I'm not going to put myself through that process of applying. And that's that. I'm just going to get back to life and go back to doing what I'm doing. And so here's my point. Previous videos, I've spoken about how attitude is everything, how with our thoughts we can change ourselves, we can change ourselves, impact our health on a cellular level just by thinking differently, by changing our lens, right? By changing our mind to change our mind, by just clinging to this attitude, like no matter what, we are going to get through this day. And I've been putting that theory into practice, and I am surprised that I bounced back. Even though I have been having a flare-up for the past 2 weeks, I've just really been in and out of bed. I'm severely limited in the past couple of weeks, which is what prompted me to consider applying for disability in the first place. But I had this inspiration today. I was thinking, I'm in special education. That's what my profession is, right? And so I've been watching the genesis of how we consider students with special needs for almost 30 years. And we went from, calling it special education and considering these students with special needs as disabled, right? What is the level of their disability? Describe their disability. And then there was this whole movement, and I know that you're aware of this, there's this whole movement. We're not disabled. The children with special needs are not disabled. We focus on the ability. What can you do? What can that child do? We talk about having abilities relative to their ability, to their potential. So there's been a whole mindset shift about children with special needs in education in this country, in the United States. And all of a sudden it hit me. So maybe what's happening with all us fibromyalgians is that we've been focused so much on what we can't do anymore, how our lives have changed, and how it sucks because we can't do what we used to do before the diagnosis. So maybe we should just be applying that whole paradigm shift when it comes to children with special needs to us, to ourselves. Be gentle with ourselves. Don't think about what we can't do today. Think about what we can do today. What did you do today? What did you accomplish today? I'm sure you did something. I'm sure you did something that was worthwhile and that was good. You did what you could do, right? So I think I'm just going to send that out and end this talk today. Just, don't think about whether we're disabled or not. Think about how abled we are. What is our normal now? What can we do? And celebrate that. We're here for a reason. We're here because this disease is teaching us how to show others how to suffer and how to be compassionate and how to navigate a day and feel that we are worthy and feel the joy in life and special moments regardless of how we feel physically. And even though brain fog, fibro fog, may impact the way that we think, and we have fuzzy thinking, blurred vision, fatigue. I've had a migraine for 2 weeks. I've been in bed between 5 and 7 o'clock at night every day. So what? So, what did I do today that was good and worthy? What did I do for anybody else? Did I do something worthwhile? Did I contribute to the quality of my life, the quality of somebody else's life? And I just want you to think about that too, okay? I know you're all suffering. I know that you have these crazy symptoms. It's just craziness, isn't it, guys? It's crazy. Somebody was talking today about tremors and about shaking and about it feels like chills and then you feel like you're on fire. Yeah. Yep. Check that box. Yep. Got that. Had that. But you know what? It passes, right? So maybe we can just ride the roller coaster of the symptoms. Just like ride it out and then, it's gonna pass. And then whew, take a breath before another one starts, right? We have to think positively. We have to. So that's my message today. I don't think we're disabled. I think we're abled in a new way. We have new abilities. We are developing compassion. We're developing a kind heart and a sensitive spirit for other people who are suffering. And we're coming together collectively in these support groups to help one another. You're doing wonderful things. So don't ever think that life is over for you, okay? I know a lot of people went to Dr. Kevorkian because they wanted to end it. Please don't think that. We have great things to contribute to society. We're millions and millions strong here in the United States. 10 million in the United States diagnosed. Who knows how many undiagnosed. 3 to 4 million new diagnoses every year, and 3 to 6% of the global population with fibromyalgia. There is something going on, guys. We are part of an incredible shift. So I hope that you are doing well today. I hope that this message inspires you and that you can find some peace and some comfort in these words. Find some joy today, okay? Think about what you can do and focus on that and And understand that there's no promise for tomorrow, right? Nothing's guaranteed. So just find today, find joy in today. It's all we have. Okay, guys, I love you. I'll talk to you soon.